Dental implants are now the most popular choice for patients who are looking to repair missing teeth. They provide a long-lasting and natural look in comparison to bridges and dentures. What is the success rate of dental implants? In this clip, we'll look into the rates of success of dental implants as well as the variables that could affect their performance. Let's first explain what a dental implant is. An implant for dental purposes is a tiny titanium implant that's surgically placed in the jawbone in order to function as a substitute for teeth that are missing. After the implant is put in place, a dental crown is connected to it for a complete restoration. Dental implants are well known for their long-lasting durability and longevity. They can often last a lifetime provided they are maintained with care. How do we determine the level of success of dental implants? The results of studies have revealed that dental implants are able to achieve an overall success rate of 95 to 80%. This success rate is because titanium, the metal employed for dental implants, is biocompatible and it integrates nicely in the jawbone. This provides a solid and sturdy base which the implant is placed on. In addition, improvements in the field of dental technology and procedures improve the efficiency of dental implants in many years. But there are some aspects that impact the rate of success for dental implants. One of them is the health status for the individual. For patients with chronic health conditions like diabetes or other an autoimmune disease may experience an obstructive success rate when using dental implants. Smoking may also affect the effectiveness of dental implants since it slows down the healing process and also increase the likelihood of failing implants. Another element that influences the effectiveness of dental implants is where they are placed, where the implant is placed. Implants located in forward part of the mouth, in which there is more bone density and less pressure upon the implant, are likely to achieve a greater success percentage than those located in the back of the mouth. The expertise and experience of the dentist who is performing the procedure also play an essential factor in the performance and the success of an implant. A proper dental hygiene routine and regular maintenance ensure the long-term success implant dentistry. Patients need to follow the dental professional's instructions on how to care for the implants. That includes frequent cleaning and flossing, in addition to attending regular dental appointments. If they don't take care, implants in the dental field can cause issues such as infection or failure of implants. In the end, dental implants have a very high success percentage of 95 to 98%. There are a variety of elements like general medical condition, smoking habits, area, and dental experience that could affect the performance in the use of implants. When properly cared for and maintained, dental implants could be a durable and natural option for those missing their teeth. If you're thinking about dental implants, you should be sure to talk with a qualified dentist to see if can benefit from this procedure.